Presentation?
Yes, we can see your presentation. Thank you very much. So welcome to day 3 of the TAFFD's 2020 Future Africa Conference. We're joined by Professor Ilia Stambler from Israel. Thank you very much. He's very much involved in longevity in Israel, but also globally, and the longevity movement and quality of life as well. So welcome, Professor Stambler. Please feel free to make your presentation to us.
Okay, thank you very much for having me. Thank you for organizing this event. I have 15 minutes, so I will try to run very fast. The topic is the need to promote longevity research and advocacy in Africa and around the world. I will start with the world, go to Africa briefly, and then go back to the world. Well, basically, what are we talking about when we refer to longevity and advocacy? Simple promotion of an idea that in order to extend health and longevity, we need to improve aging processes, because aging is the main risk factor for all age-related diseases. So basically, if we're serious about preventing most of chronic diseases, we should be able to intervene, ameliorate, as some say, cure aging processes. So that's basically the idea of longevity advocacy, of Geroscience, and that's what we're trying to promote. Is it feasible? Is it possible to intervene into degenerative aging to extend health and longevity? Yes, it is feasible. There are many proofs of feasibility in animal models, a little bit of human trials. This is an example of the so-called pillars of aging, or main directions of aging research, according to the NIH Geroscience interest group, that delineated 7 priority directions in aging research. Each direction targets a certain class of aging processes with a certain panoply of interventions. And there are proofs that this does work in animal models, and the hope is that we can move to humans. Of course, you cannot treat something that you cannot diagnose. So alongside the various therapeutic interventions, there must exist a panel of biomarkers or measurements of aging that will allow us not only early diagnose age-related disease, but also measure the effectiveness of anti-aging interventions. This is a major topic that must be promoted as well, because once again, you cannot develop therapies without diagnostics. A couple of examples. Of course, everybody knows the TAME study, which is kind of paradigmatic experiment in the Geroscience, trying to prevent or postpone several age-related diseases at once by single interventions, by intervention to aging processes. I will say a few words about an experiment, about a study I was involved in that we recently published with the Chinese colleagues. They did the experiments. I mainly participated in discussion, in interpretation, but I'm a co-author. So basically, what they did is they intervened into COVID-19 patients at a very late stage, at critical stage, by mesenchymal stem cells, which is a known anti-aging therapy, and they were able to basically recover those patients by diminishing their cytokine storm, their inflammatory response, which is the main cause of death. That shows that anti-aging interventions can be effective against not just this or other disease, but against all age-related disease, because as we know, COVID-19 is also an age-related disease because it affects the elderly. So by trying to affect the aging process, immunosenescence in this case, cytokine storm and inflammation, we can not only maybe hopefully prevent unhealthy aging, promote healthy longevity, but can actually also intervene into actual disease. Another example from that is relevant to us now. You know that COVID-19 is a very codependent process. It's actually more of a multimorbidity phenomenon. It's not just one single virus, but a virus that acts on a certain unhealthy state of the organism. so it works together with multiple other diseases. So it is important to develop ways to measure the contributions from various diseases, their synergies. So that's what we have been also trying to work on even before this COVID-19 started, trying to develop measures for multimorbidity. As I said, we can diagnose. So basically, these are just two examples of first of intervention, then of measurements within the geroscience paradigm, within the geroscience approach, trying to intervene into aging to prevent age-related diseases, extend health longevity. Why do we need this? Quite obvious. Forget about the need of people to be healthy. We also save money for the economy. So we're among longevity advocates, so we can say directly that we want to extend healthy life. But in some places it's also helpful, to say that you money to economy.
Professor Stambler, we've lost your audio.
Do you hear me again?
Yeah, that you come back. That's fine.
So I was just saying that of course we want to be healthy in old age and extend our healthy life. But in some places it is helpful, to show that actually by doing this you also save money for the economy. So they will fund your research. Yeah. And who will benefit from this kind of intervention? Basically everybody, the general public, the pharmaceutical and medical technology industry, health insurance, life insurance, regulators, policymakers, scientists, students. Basically all the segments of society should be involved in promoting health longevity, each from the angle, each contributing to everybody will benefit from. And now we go to Africa. Some people claim that this entire anti-aging pursuit, this pursuit of health longevity, is not relevant for Africa. Africa has a very low, as a whole, has a very low life expectancy, and people mostly suffer from infectious diseases. The general standard of living is low. So why are we trying to advocate for anti-aging? Is this just the rich folks' game? And I think nothing can be more erroneous or even dangerous for Africa in the first place. First of all, many arguments can be brought. First of all, the life expectancy in Africa is increasing the fastest in the world. Actually, you can see that from 2000 to 2015, the life expectancy in Africa increased by about I think about 10 years, which is 8 months increase in life expectancy in a year. That's even close to longevity escape velocity. Longevity escape velocity is 1 year increase of life expectancy per year. So Africa is actually getting close to that. But it may slow down at some stage. But right now you see that Africa is aging very rapidly. And if the anti-aging is not relevant now, it will be relevant for sure in a couple of years. So we should be better prepared, because right now the geriatric and gerontological facilities in Africa are grossly unprepared to this rise. So if we advocate for it now, if we advance this field now, we may actually save a lot of people's life, will prevent a lot of suffering. And even now, in absolute terms, not just in Africa but throughout the developing world, in absolute terms, the mortality from age-related diseases is about 80%. So it's by no means a involvement of the developed world, but also the entire world. A lot of people worry about the overpopulation as a result of life extension. On the contrary, I personally believe that there is no such inherent problem of overpopulation. There's only a problem of lack of resources, when people don't have enough food. So if we're able to develop this kind of technologies, we'll also be able to feed the people, and also their quality of life will improve, as automatically there will be a less problem of population, as happened throughout the developed world. With some conspiracy or some evil plot, it's basic mechanism of human population development. Your quality of life improves. You have less children. You live longer and healthier. Also what will happen in Africa. So by all means, it is important to advocate in Africa to improve scientific medical capacities in Africa, because so the need is clear. We need to promote longevity research, longevity therapies. How do we do this? Basically, as in any social movement, when we believe in something, when we think that something needs to be done, we advocate for it, we build a movement for it, we educate for it, and the same needs to be done also for longevity research and advocacy. That's by no means a purely scientific field. It's also a social field, a field for advocacy. Advocacy can be done on every level, from the international level to the individual level. I will briefly list some of the things that are being done or can be done. First of all, at the international level, we can study various international policy frameworks from the WHO, from the United Nations, try to see the sections that can be supported for aging research, try to raise awareness about those sections among decision makers, and if possible, even influence the sections. For example, in 2017, the longevity advocates were able to introduce aging as a part of the WHO work program. That's entirely thanks to the longevity movement, to longevity advocacy, and we need more of this kind of. Now, at the national level, of course, most of the funding, most of the promotion is done at the national level. We need to develop policy recommendation and then bring them to decision makers. This is an example of a policy position paper of the International Society on Aging and Disease. It advocates for increasing funding, incentives, and institutional support for aging research. It was translated in 12 languages, submitted to several governments. So that's kind of an example of the things that can be done at the national level. Of course, the main advocacy unit is an NGO, is a particular organization, advocacy organization, like TAFFD, like I don't know, like the Transhumanist Party, like the Israel Longevity Alliance. So that's where most of the work is concentrated. So we need to develop those organizations, bring membership, bring funding. These are some of the activities that we do in our Israeli association, like education and awareness, communication, and support for makers, analysis and data processing. For example, we issued a report on the longevity industry in Israel, 700 pages. That was also a these are the kind of things that can be done, and you're also doing brilliant work with your publication, with your conferences. That but the ultimate advocate is every single person. So we don't have to wait for the government to do something, or to band together. Each one of us can do his own or her own part. Do your research, in relevant field. Join with others, participate in research, lobby, and just please be healthy. Live long enough to live even longer. All the usual things that we can do to like nutrition and exercise to increase our chances to live to the emergence of actual life extension therapies. Okay, so all this is good and well. How much time do I have? Another 3 minutes. All this is good and well, but does it work? All this rationale is clear, and the actions are clear, but is anybody living long and healthy because of all these advocacy activities? Well, it is too early to say. The entire anti-aging advocacy movement is very young, maybe 10 years. It's more or less on the radar, but already we can name a few successful initiatives, and hopefully they will intensify and bring actual results in terms of health longevity. So I will not go into details, just a few initiatives I personally was involved in, like the position paper I mentioned of the International Society on Aging is the Longevity Month campaign that has been run in dozens of countries with tens of events. The longevity dividend campaign, I had the honor to sign the initial longevity dividend petition back in 2006. So, you know, it also made a contribution, you know, to awareness about aging research going since. There was recently a series of conferences organized by the National Institute of Aging, the International Perspectives of Geroscience, also in Israel. So it also raised awareness, and recently also established a group in China. You know, that also play a role. So all kinds of initiatives come together, you know, to advocate for the field. And it does have some effect. You know, the best example I know of is that the campaign that we did in 2017 that actually changed the WHO policy and introduced aging as a part of its work program until 2023. It wasn't there before. Now the problem is, as it entered, so they forgot about it. Now they again excluding it from all the work programs, all the you know, even canceling the aging division. Well, I don't have the power to to start arguing with them again. You know, if they want to cancel it, you know, there are other venues. But at least, you know, it shows that longevity advocacy is possible and can bring some effects. There was also a successful initiative of the International Longevity Alliance, mainly to include aging as a qualifier, as a modifier in the ICD, in the International Classification of Disease. So now at least the physicians can relate to aging out of here in Israel. We're also successful. Actually, in more practical terms, we have achieved a few calls for research proposals, national and also international, like the Britain-Israel Research and Academic Exchange on Aging. There was a joint call for research proposals between Israel and in the UK, and I had the honor to write the first draft of this call for research proposal, focusing on geroscience, you know, prevention, biomarkers of aging. So that was kind of another contribution. We also introduced aging research as a part of the Israel National Master Plan on Aging. It wasn't there. So all this comes to say that longevity advocacy can be successful, you know, if you really put your effort in it. And I hope we will continue this work in Israel and internationally. And I encourage everybody to do their part in their organizations and their countries. So hopefully we will all you know, enjoy the fruits of our labor in terms of, you know, actual therapies that will come to us and help us and our loved ones to live longer. I you know, just any questions if there are, happy
Yes,
to
please.
answer.
Yeah. Thank you very much for that very enlightening presentation and synopsis of longevity and your work. Excuse me. Gennady, just unmute you if you'd like to answer your question.
Yes, thank you very much, Ilia, for your presentation. Now, you and I both know about the greatly increased vulnerability of people who have been ravaged by biological aging to COVID-19 and other infectious diseases. And the challenge now is to enable the general population to make that connection clearly so that research against aging is better funded and better supported. Have you observed any greater recognition of this connection in international organizations of the caliber of the WHO? It would seem the WHO ignoring aging once again would be contrary to that recognition. But do you see any sort of shift since the pandemic has set on?
Great question, Gennady. You know, in terms of logic, yeah, that should work. There's certainly increasing recognition of this connection in the longevity movement. So now we understand that from all our argument, it's probably the one that should, touch the nerve of most of the people now. In terms of actual effect, we still have to see the actual effects. We've been trying, we addressed the petition of the WHO, zero response. We've been trying to talk with some governments. So far, there is much response either, but we'll see. You cannot give up at this stage. We are just trying. But certainly, the longevity movement itself, the longevity advocacy community, recognize the potential. So I hope we can develop it to some results.
Yes, indeed.
Logic, we understand logic, but we had the logic before as well. We had the longevity dividend argument, and we had all the social arguments that nothing worked. But maybe this time, when people are actually scared for their lives, they'll understand, that they have to actually do something.
Are there any other questions from the floor? I noticed we had an extra few people join us. Hopefully you caught the end of Professor Stambler's presentation. Are there any more generic questions regarding longevity that anyone might have? If not, then I'll thank you very much, Ilia, for joining us, for sharing, spending your valuable time with us, and for all the work that you're doing in this area. Excuse me, my throat's going after 3 days talking. The next session will start on the hour at 9 a.m. Pacific time. That's 5 p.m. UK. And oops, I just pull up the
in 10 minutes, right? So I'll be happy to sit on it.
Yeah. So I'll share the slides. So that this is a panel session on public health service in Africa. So hopefully everyone can stay on for that. And Professor Stambler, if you're also able to stay for that panel session, that would be most useful. So I'll pause the recordings for now and restart when we have our panel session.